everybody. And we have a lot of people registered today. And we have people from all over the country. So, I'm amazed at all of the people from different parts. We have Deanna coming here from North Carolina, Madeline from Lapine, Oregon, which sounds real pretty.
Yeah.
Hi, Madeline. Yeah. Therita from Bossier City, Louisiana. Hi, Therita. Thanks for joining us. Deneen from Covington, Georgia. We have Richard from Slocum, Alabama. And I love hearing what you guys all have to say. Brandy Ray from Georgia is excited to learn and grow today. Thank you, Brandy. So are we. This is very good. And Micheline from Greenfield, Indiana is interested in learning more today with us. So Welcome, everyone. Thank you. My name's Jennifer Falk. I'm the Director of Development at MS Views and News. And MS Views and News is a nonprofit organization that provides information and resources to the multiple sclerosis community. And this is race, culture, and community while living with multiple sclerosis. But as I say, every time that we meet, all of our information that Sheila is sharing with us really can be applied to anyone living with a chronic disease or healthcare challenges. And this has just been a wonderful 4-part series. And tonight is our last episode or last chapter. So, it's bittersweet, but we did cover a lot of topics. It was very powerful at times and very enlightening. We've got tremendous feedback from all of the people that participated. So we thank you for that. We also would love to thank supporters who saw the value of this program. Biogen, Bristol Myers Squibb, and Novartis, we thank you for that support and for making the series possible. I would like to thank Sheila Thorne, who is our presenter. I don't know who could have done anything like this other than Ms. Sheila Thorne, and she just did an incredible job and put so much work and heart and passion into this. So we thank you, Sheila. This has been beautiful, and we're very grateful to have had the opportunity to work with you.
It's my pleasure, Jennifer. It has been a journey, and I think we know that when you come to multiculturalism or embracing and celebrating diversity, it is a marathon. It's not a sprint. And so we hope that what we've shared with you will stimulate and motivate you to find out more about the groups who might be in your community.
Yes. Yeah. And that's really was the goal of this.
Exactly. I wanted to take a few minutes, Jennifer, to thank MS Views and News, Stuart Grossman and Schlossman, and yourself for helping me to have this opportunity to talk to your viewers and those who read your material and follow you. We're living in a very challenging time right now. COVID-19 has given us all new consciousness on a number of different levels. It has been emotional, it has been challenging, it has been disruptive, but in a way, it's been a wake-up call to all of us that some of our systems, our health systems, aren't working very well, and some don't work at all, especially for people who are of African, Hispanic, Latino, Asian, and Native American descent. And we've got to fix that. And so the first step in fixing that is education. Education is necessary, not diversity training, but diversity education, understanding where these groups are in the history that they have to share with us and all of the things they've done to build our great country. So I really thank you for the opportunity of sharing all the richness that we have as a community. And hopefully coming out of this pandemic, we'll know how better to work with each other, to talk to each other, especially those that are living with serious chronic disease. And that's really our mission and our goal here. And it's been my pleasure to be a part of that effort. I'd love you to share with your listeners what has been the cumulative number of those who have watched this series over the last 4 months.
Oh, well, definitely. We've been impressed. We've actually had 181 people register for the series, and to join us live over the last 4 months, we've had 187 guests and attendees. And
wow.
We've received feedback and comments, and everyone's really impacted by the information that you've been able to deliver. Anyone that's watching tonight, or if you see this later, we have all of these programs archived on our YouTube learning channel. Mm-hmm. So, just in the last 4 or 5 months, we've had over 500 views there as well. So people can continue to learn even after this is over. This will always be there as a resource and as a reference to share. And that's, all we can hope is that people continue to watch and learn and connect on these programs. So.
Exactly. Well, that's impressive. Thank you so much for that, especially it's late in the evening and clearly people have much to do, but they took the time to listen in and to watch and to learn. And that's definitely a good start. It's clear that we definitely need to know about each other. And the community that we're going to be talking about tonight is one that is not as often on the agenda, our Native American communities. And there definitely are stories to be told and issues regarding that community as well. So tonight I pulled together some of the information that I've been privy to learn and the people that I've worked with. I've worked with people in the Cherokee Nation. I've worked with people in the Navajo Nation. We have a special guest at the end of the presentation tonight that's from the Shinnecock tribe in New York, and she's going to share with us what she can help us to understand about this community. Well, I think first and foremost, as Jennifer and I were talking about this program, both of us were very, very serious about finding whatever data we could about people of Native American descent who have multiple sclerosis. And it may not surprise you to know that the data are scant. And as I talked to physicians after we saw we couldn't find very much, physicians were not surprised. They feel that perhaps the numbers are low or non-existent because this condition is underdiagnosed in this community. And as you'll see as we go through this presentation, many who were on the reservations are now moving to the cities, to the urban centers. And so sometimes that causes a disruption in how the disease prevalence is recorded. But we're all in the mode of cultural competence. We're all in the mode of diversity and inclusion. Diversity, equity, and inclusion. Diversity, equity, inclusion, and belonging. That's in the air. Everybody's talking about it because clearly these groups have disproportionately suffered, die sooner, suffer more from chronic disease. The one thing I did find, as you can see on this slide, is that it's very rare in the population that we would call Alaska Natives or Eskimos. But again, the data are not clear. There's not been a lot of study done, but I think as we begin to raise the awareness in this community, we might find that there's more there. No data on Native Americans at all with regards to multiple sclerosis, but as you're going to learn tonight, there are a lot of data on disease states that certainly would impact this population more than others. Next slide. So we're going to talk about culture, and culture is something you learn. You learn that from your family, you learn that from your neighborhood, you learn that from your community. It's shared. It's values that we share with each other, norms. You know what's respected by virtue of what is acceptable in your culture. And that culture, whether we got here on the Mayflower decades ago, centuries ago, or whether we just landed at JFK, culture drives behavior and attitudes, especially with health. Next slide. And this is the phrase that we've heard bandied about for the last 2 decades. And it's a phrase that definitely speaks to where we want to be. It's not about cultural sensitivity. That just knows that you may use a term or slur that's offensive. This is about action. This is about understanding behavior and beliefs and policies and responding to them. So the question comes up all the time, are you culturally competent? Do you know the differences in culture? Are you aware of some of the things that these groups value, treasure, and whatever that may do for their behavior? So that phrase is more appropriate because it's action-oriented. It's not passive. It means once you know something, you respond to it. Next slide. And this is the group we're going to be talking about this evening, Native American Indians. Many that I work with in the community often refer to themselves just as Indians. Native Americans, Native American Indians, those are the expressions commonly used to refer to these populations. Next slide. And if you definitely were a part of the census taking, even though that was cut short because of the pandemic, these are the two ethnic groups that you might have seen on the census: AI for American Indian, AN for Alaska Native. Now, if you check those boxes, there was another side that said you can put in your tribe, exactly where you've come from. And now these two groups are what we call indigenous populations. And so now we have a new expression that you may have heard and maybe have used it: BIPOC, Black Indigenous People of Color. Now, don't let that phrase fool you. It has nothing to do with the pigmentation of your skin. It has to do with shared experiences. And they added the I because many felt that we don't give enough credit to that group in terms of what they have endured and what they have suffered as indigenous populations. Next slide. And here's the brief history. I hope this session tonight will stimulate you to learn more, but this clearly is the basis for the history of Native Americans in this country. And that was in 1607 when the English colonists landed in Jamestown, Virginia. All of these tribes began to be a part of the landscape, but unfortunately they were destroyed. There was constant warfare and there were catastrophic diseases. The colonists that came over brought with them measles, smallpox, malaria, whooping cough, tuberculosis. But the Native American Indians didn't have any immunity over these diseases, and it decimated these tribes, and almost catastrophically, many of these tribes disappeared. Next slide. And here's a map telling you where they are. All over the country, all over America. These are where the American tribes are. Maybe some of them are in your community. Maybe you even know or have been on a reservation to have engaged or really interacted with members of this community. Next slide. But just to sum it up very quickly, 574 federally recognized tribes in 37 states. And we're going to talk about what that phrase federally recognized means. But you may not even know that this many tribes exist, Native American Indian tribes in this country. Next slide. And here's that expression, federally recognized tribes, almost 600 of them. If you want to be a federally recognized tribe, there are specific requirements that you have to go through to do that, to improve to document your genealogy, to prove the membership of your tribe, whatever influence you may have over the members of your tribe, all kinds of documentation in order to get that designation. And why is that important? Because that will enable you to get special services, special funding. There may be grants, there may be compacts, and obviously that recognition is critical. But even though there are almost 600 of these, next slide, there are about 400 unrecognized tribes. And by the way, there are about 70 state recognized tribes as well, which entitles you to certain services and benefits. But there's still many more Native American Indians that are in these federally recognized tribes. Next slide. Well, who are this group? Where do they come from? I think it's critically important for us to know that they were here before any of us came. In fact, they're the only true Americans. The rest of us are all immigrants because we came at a later date. So the culture then was well established in this country prior to anyone arrival from the European shores, European explorers. But it's a very diverse culture, very different one tribe to the next. But we're going to find out tonight, there are some common threads that you might recognize in all of these tribes. Next slide. And here's something that I'm hoping to discuss a little bit later on with a guest speaker from the Shinnecock tribe, and that's an identity card. And here are some samples of that card. Now, why would you need that card? Well, having that card entitles you to certain benefits and to certain financial and legal resources. So you have to provide documentation, genealogy, to make you eligible for having this card, this identity card. The Navajo Nation, the Shinnecock tribe, and the Blackfeet Nation are just samples to make it bona fide and credible that you are of Native American descent. Next slide. Unfortunately, Hollywood and the media has given somewhat of a negative image of people from this community. When the colonists first came here and they saw the Native Americans, They thought they were savages. They were running around half naked. They didn't speak the language, and they had very strange traditions and customs. But that certainly does not accurately describe the richness of the culture in this group. And of course, we have Walt Disney with Pocahontas, which is now seemingly a very derogatory term in some circles regarding Native American women. So as with African Americans, Hispanic Americans, and Asian Americans, you have to take all of what you see in the media with a grain of salt. It may be for entertainment purposes, but we don't want to let those stereotypes become ingrained in us so that we respond in a negative way. Next slide. And I hope that you'll do some homework on this couple, because there's a lot in the news about this group. I'm not going to tell you about them. Why don't you do your homework in history about whether this marriage, this union between this colonist and this Native American woman, which settled wars between the colonist and her particular tribe for many, many years. But there's some truth and there's some fiction there. So I'm going to leave it to you to find out which it is. Next slide. What about the beliefs of this group? As we said, culture is about beliefs and communicating those beliefs. Well, you don't want to stereotype this group. Each tribe has its own unique set of beliefs, and these traditions will vary from tribes to individuals. There are similarities, but there are definitely also some differences. Next slide. Spirituality is a thread that runs through most communities of color. It clearly has been the soul and the lifeblood of many of these communities, and it's no different with the Native American community. But as you can see here, there are thousands of individual approaches to spirituality, to whatever the rituals are in spirituality or the traditions. But know this, spirituality is an important component in the life of people of color, as well as specifically with Native Americans. Next slide. Here are just some of the values that I was able to research and also observe in the friends that I have that are Native American. Again, this may not apply to every single person in this community, but it applies to many. Respect for elders. You find that also in the Hispanic, Latino, the African American and Black community, and the Asian community. Respect for the environment. Living simply, being humble, generous, taking responsibility for your actions, and the connection with nature. That is something that stands out in my mind with this particular population. Next slide. Unfortunately, as with other segments, when people don't understand the group, they often create stereotypes based on perhaps one personal experience or what they might have seen in the media. And these are some of the stereotypes that unfortunately have been pervasive and persistent in the Native American community. Slanted at best, totally untrue with regards to labeling a whole population with this kind of profile. Next slide. I wanted to also show you some of the government agencies. This is the only community of color that has several government agencies specifically devoted to them because of the way they were treated when the colonists first came to this country. It was kind of the way the United States or the federal government wants to correct the errors of their ways. And here's one of the groups, the Bureau of Indian Affairs. And this is a group which possibly can help these populations with grants or compacts or contracts in order to better their community. And this young lady is head of that group. She's not a Native American, she happens to be Alaska Native. Next slide. Unfortunately, health disparities exist. And unfortunately, these disparities, again, are pervasive. Tuberculosis, alcoholism, obesity and diabetes, we're going to talk about that one a lot. Accidents, and unfortunately, suicide. The question is, don't blame the person that has these conditions for perhaps not living appropriately or eating right. Let's look at the resource and the sources for why these disparities exist. Next slide. This is a group that I've had the pleasure of working with over the years, the Association of American Indian Physicians, based in Oklahoma. Now, each one of the ethnic segments has its own medical society: National Medical Association for Black doctors, National Hispanic Medical Association for Latino doctors, and the Asian Pacific Islander Physicians, the National Council of Asian Pacific Islander Physicians. Well, why do these groups exist? Well, because unfortunately, until the late 1970s, those physicians were denied membership in the American Medical Association solely on the basis of race. And many of them have come forth to apologize for marginalizing and excluding these physicians. But if you want to learn more about any of the conditions or diseases that affect Native American Indians, this is a group that might give you resources and information. Next slide. And the Indian Health Service. We're going to talk about that a lot later as well, but it is the federal health provider and health advocate for Indian people. Ms. Fowler is the acting director right now, and she is from the Comanche Nation. And they serve, or they provide health services to 2.6 million American Indians, even though the numbers are twice that. And you remember how many tribes? 574 in 37 states. That's what this service is there to accommodate and to do. Next slide. And I thought you'd like to see some of the leaders in the Indian Health Service. Each one of them individually come from a Native American tribe, the Chippewa, Navajo, Cherokee, Sac and Fox, and Seminole. So it's important that you have people working for these populations who are from these populations. And this is a demonstration of how they can definitely connect with, because they understand those populations and their rituals, their traditions, their health attitudes and behavior. Next slide. The Indian Health Service is widespread throughout the country. As you can see in the map we have where all the tribes exist, 12 area offices, 24 acute care, 50 health centers. We're going to find out later on that although those numbers seem impressive, it's not nearly enough. Next slide. And tribal healthcare as well. That's something more specific and related and connected to the actual tribes on the reservations. Next slide. And urban Indian centers. This is an interesting one because some of the population that were on the reservations are moving to the cities, to the urban centers. And when that happens, sometimes the healthcare delivery, people fall through the cracks and you can't find them. But here, this is trying to make up for that by creating these Indian centers. But look at the amount of money. They receive less than 2% of the Indian Health Service budget. Clearly not enough to cover the numbers in this population, be they on the reservation or be they in the city. Next slide. Now we'd like you to take a look and listen to some from this community and how they have been dealing with the lack of services and the difficulties in getting health care.
Creek Tribe. And so like kind of the cool thing about the Tulsa metro area is like the south and western end of it is actually on the Creek Nation reservation. So I spent most of my life growing up on Creek land. One thing that I always kind of noticed is like the poverty that was in there for like a first world nation. Yeah, I have relatives who live in houses that have dirt floors and they're young children. You'd see young children who would get like medical conditions from getting bitten by fleas too much and things like that. So, you know, a lot of abject poverty. So in Okemah, which is the town that my mom is from, there is a Creek Nation dental office. However, there isn't a Creek Nation hospital until you get to Henrietta, which is about 22 miles to the east of Pima. And so if you were not on private health insurance as a Native American, you would have to drive over to Okima to see Henrietta to see a doctor or things like that. And the nearest large hospital that could accommodate more than just a routine doctor's office was in, I believe, Ada, Oklahoma, and that was the Choctaw Nation. One time it was actually, I think, when my grandmother I was with her, I was spending the week with her, and she had to go, she felt bad, so she wanted to go to the hospital, so she wanted to go into the IHS hospital, and she was having to fill out paperwork. There's lots and lots of paperwork, and for each paperwork station, there's a line of about 20 people deep. And as she was filling out one of the forms, they're all color-coded. I think that one was the green form. The lady working the counter said, now the person at the next line is going to tell you shouldn't have filled out the green form, that you should have filled out the red form. But you need to tell them that I said, no, the green form is fine, not the red form. And so it's just a lot of government bureaucracy. It's a lot of, we would always call it crap in the pipe. It's just going to keep it from flowing. And so that's something that we really noticed, was that was a really common thing. And so that contributes to those wait times, is that reconciling all the government forms and things like that. And it's like the DMV, only except everyone's sick. So it's a lot of form, a lot of wait time. You often run into people who want to make it abundantly clear that they do not want to work there, and so it's an issue like that. And a lot of the times, a lot of IHS doctors are actually people who they are Native American, and they are working for the IHS due to an IHS scholarship they got from medical school, and so then they view it as kind of like a Doctors Without Borders thing. It's, I have to work in this really destitute, impoverished area, and then I can move on to a private hospital where the pay is dramatically better and things like that. So it's, almost all parties involved working for it really don't want to be there, and then you tack on just the megalith that is the federal government and funding through that, and that's a really big issue.
My entire family, even into my extended family, uses IHS. While we're members of the Cherokee Nation, we go to the Citizen of Potawatomi Nation Health Clinic in Shawnee, which is the closest one to where we live. This could be a rumor, but they say you get in quicker at the clinic if you have private insurance, because therefore your billing's easier. And so we've never had a problem getting in, but some people, you can wait weeks to get in. Definitely most of our experience have always been positive. The physicians and nurses there are so welcoming. They're really they know you by name. You just call and they're like, you give them your date of birth and they already know who you are, and they're super forthcoming as far as we can get you in on this day, and if not, sometimes there's a wait, but it's just they service so many people, it's really hard. I think it's important to look at, when it comes to Native American health, the factors that are playing into it, and oftentimes it is because of, they have higher rates of obesity, HIV, suicides than pretty much any other ethnic or racial minority, and you have to look at why, and a lot of it stems from discriminatory policies of the past, from the assimilation and eradication eras. And so you have to not only treat the disease, but also the stigma behind the distrust of medical facilities. And so that's why implementing more tribal hospitals in tribal communities makes it better, because they're more trusting of that type of care. I definitely think implementing more federally qualified health centers are a good idea, because while working at one this summer, I saw they really put a big focus on preventative medicine, which most of the diseases and conditions Native Americans suffer from are preventable. You have type 2 diabetes, and so that can be changed with diet. You have HIV, which better sexual education can help. All of these things, smoking, alcoholism, everything can be adjusted with education. And so having a community center or a hospital that's focused on preventing the problem before it takes root is really important.
I am a member of the Wichita and Chickasaw tribes. I'm enrolled with the Wichita tribe. My mom and uncle actually left the reservation as small children, the Wichita reservation, that is. So my grandma took them from the reservation in hopes of having greater opportunities, better life. I was actually born at the Claremore Indian Hospital, so that's where I started my life. So I'm actually a recipient of a 2015-2016 Indian Health Services Scholarship. I'm trying to enhance students' awareness of how mental health services are delivered across different tribes in the state of Oklahoma. So the current state of mental health care among tribes is very vast and varying. It's going to depend on the tribe specifically. So there are large disparities in that we have some tribes that are very well established, have the funding and the foundation laid to implement, like just general health services as well as mental health services. And then we have some tribes that are still growing and developing these systems. So one thing that's unique about tribal health care is this cultural component where whenever we're developing these systems, we have to be very mindful of what are some of the traditions, the cultural practices, the history of the tribe, what is the healthcare state. There's also this disparity, and there's a great amount of need and not enough resources to meet that demand. So it kind of interferes with some of the efficacy and efficiency of providing those services. Our people are thriving and we're growing and we're actively maintaining, this legacy that's been passed down to us by generations and by our ancestors. And so there's actually a lot that goes into, I think, fully understanding Native American community and the different tribes. Such an abundance of information that, I'm humbled to see, just how much I don't know. But with that, I can take what I do know and make a positive difference in the lives of others and deliver on this legacy that I have and that I carry with me every day.
So that gives you a little bit of the taste of what's going on in the community with people from the community. And it's always good to get those stories because that's the real world. The one thing that was mentioned in one of the scenarios was about diabetes. The rate of diabetes in the Native American community exceeds all other ethnic segments. We know about African Americans, we know about Hispanic Latinos. Maybe you didn't know about the extent of type 2 diabetes in the Native American community. And the statistic there shows you it is over and beyond whatever else you might see in other ethnic segments. Next slide. And in particular, as you see these statistics, kidney failure, all of the complications that goes with diabetes is being reduced in the Native American community, but it's still a very real factor. Next slide. And one tribe in particular, ladies and gentlemen, we're going to give some thought to, and that's the Pima Tribe. And they're located in various amounts of other countries, but Arizona is where we find them in the United States. This is a fascinating story about type 2 diabetes in this particular tribe. Over 50% of the members of this tribe have type 2 diabetes. Next slide. And the prevalence is with this particular tribe, the Pima Indian tribe, compared to other areas of the country which have similar ethnic segments. Far and beyond, it is clearly a very serious problem in this tribe in Arizona. Next slide. And part of the problem is because of the environment, because of water. The Gila River, which runs or used to run through this tribe, unfortunately, when white settlers and others came in who were farmers, they diverted the water not to go through the tribes and their land, but to the farmers who wanted more of the water. And when that's happened, all the wildlife went away. The agricultural basis of the community went down, and clearly disease started to occur. So when you talk about bias and discrimination, policies are also a part of that. And the children of those in the Pima tribe more than likely have type 2 diabetes. And that's metabolically and also genetically, but the environment played a role in that. Next slide. And there have been many programs the government, the Indian Health Service, and others have put forth to try and educate the community about diet, about lifestyle, And it has made a dent, and it's probably why the kidney failure rate has been declining. But certainly much more needs to be done. You know that diabetes is a complicated disease, and the complications can be devastating. So type 2 diabetes clearly is one of the major disparities in this community. Next slide. And the children, obviously, we're having the same problem in our country with obesity in children. 31% of Native American children ages 2 to 5 are obese, 2 to 5 years old. Obviously, we need to do a lot more education there so that hopefully they can prevent the onset of type 2 diabetes and the complications that go with it. Next slide. Here's the interesting part. Because of the diabetes and the degree of diabetes in this community, it has been the most researched and studied of all populations throughout the earth. Much of what we know about how to treat diabetes, how to diagnose diabetes, came from the government studying this particular Indian tribe, the Pima Indians. And this is not even the United States, it's in terms of being studied around the world. Next slide. Let's talk about the Navajo community. It's the largest reservation we have, 300,000 people living on the Navajo reservations. Next slide. And here's where they are in our country. Maybe you're in this part of the country, and perhaps you've enjoyed interacting or at least understanding and learning about the Navajo Indian tribe. Next slide. And here's something that's going to give you some insight into that community.
Easy to miss this corner of the Navajo Nation, just 100 miles west of Albuquerque. Most things pass the reservation right by, including progress. Many of the roads here are unpaved. Electricity is spotty. Unemployment in the area hovers near 70%. But perhaps most shocking of all, an estimated 40% of the people who live here don't have access to running water.
And the sink, what does the sink do?
We don't use the sink because there's no running water.
It's just there.
Yeah.
Loretta Smith and her husband share this small mobile home with their disabled granddaughter, Brianna.
7? That's how old?
With no indoor plumbing, what little water the family has inside is carried in, bucket by bucket, stored in plastic barrels outside.
Do you feel sort of forgotten out here?
Yes. For sure, yeah.
The area's main source of drinking water is miles away, in the parking lot of the St. Bonaventure Indian Mission, in the town of Thoreau, New Mexico.
Okay.
Getting water here can mean a 100-mile round trip for some families. And the mission's office manager, Cindy Howe, says many don't even have access to a car.
What happens when they run out of water?
If they don't have any water, it's just they don't have any water. And sometimes I get so frustrated. Why can't people get water?
And that's where Darlene Arviso comes in.
They call her the water lady.
Every day, Darlene loads up her big yellow tanker truck and takes to the roads to deliver something most of us take for granted.
When I see her coming, I get, yes, water.
Darlene is Navajo, born and raised right here on the reservation.
Pretty much know everybody, right?
She's used to carrying precious cargo. She's been driving the school bus on the reservation for years. But her water route is a job that she considers almost sacred.
I'm proud of what I'm doing for my people, and I love my job. So.
Do you?
Yes, I do.
What do you love about it so much?
Like, I go out every day to meet different families, yeah.
There are 250 homes on her route, and she can only get to each family once a month, and sometimes not even then if the mud gets too thick. Which is why when she does make it, it's often treated like a celebration. Nina Garcia has never had a day with running water in her life. Unlike the rest of us who use about 100 gallons of water a day, Nina has been getting by on only about 7 gallons. That's a hard truth that Darlene has a hard time watching.
Sometimes I wish I could do more.
How do they make it last so long?
Well, they just have to stretch out their water, and yeah.
I say this, as having been raised Catholic with full knowledge of what I'm saying. Darlene Arvizo is a living saint.
The fact that this man, George McGraw, is on this reservation at all is a testament to just how dire the Navajo situation is.
Do you see yourself?
He runs a nonprofit called Dig Deep. He normally works in developing countries, digging wells in places like South Sudan, Kashmir, and Cameroon. But now, the problem is right in his backyard.
I really had no concept that this kind of material poverty existed in the U.S.
But it does. The question is, why?
It should be regarded as a national embarrassment.
We took that question to Dan McCool, a political science professor at the University of Utah, who studied Indian water rights for the last 40 years.
How is this possible in this day and age that Americans don't have running water?
American Indians in Arizona and New Mexico were not allowed to vote until 1948. They did not have a voice. They weren't in line politically when the money, the funding, the projects, and the water was being allocated.
So the only source of water left for the Navajo is groundwater, lying deep beneath the hard rock of the Continental Divide.
We took this project to hydrogeologists, to engineers, to construction specialists all over the country, even here in the Southwest. And everyone said, well, this is one of the most challenging projects we've ever seen.
Even if they can find water, it might not be drinkable.
You'd probably start to hit water here at about 600 feet, but the water you'd get out would be laced with uranium.
That's from years of mining on the reservation during World War II. Older water wells dot the landscape. Sarah Begay, who's lived on the reservation all her life, took us to this one. It's still pumping water, but few dare drink from it anymore.
For years, maybe a good 20, 30 years.
It was fine.
It was fine.
And then what happened?
People started getting sick.
So Dig Deep must dig deeper, and the clock is ticking.
Running out of water by the middle of the month is a painful experience.
And most of them do.
Yeah, most of them still do.
Good morning.
Lindsay Johnson makes sure she doesn't run out. She has a system to conserve every drop Darlene delivers.
What would you do without her?
I don't know.
Aside from her morning coffee mug, she uses only paper plates and cups, so she doesn't have to wash dishes. Like her fellow Navajos, Lindsay shares her home with as many as 8 other people. When it comes to washing hair, 2, maybe 3 of them will all use the same water.
Good.
Lindsay's 16-year-old granddaughter, Yvonne, says almost everyone here finds ways to cope without running water, but few want to talk about it.
People don't share their stories.
Yeah.
I don't either.
You don't tell them? Because why?
It's kind of embarrassing. It's just hard.
So who's to blame for this?
The counties and the states say, oh, it's the federal responsibility, and the feds say, well, we're broke, it's the states and the counties' responsibility.
It's a lot of finger pointing.
Oh, yes, yeah, a lot of passing the buck.
And so, the Navajo wait.
Has Darlene kept you updated on everything going on with the well, the new well?
Yeah. George's Dig Deep well is coming along, but it will cost close to $500,000 to complete, and all of it is funded by donations.
It's worth it.
But even if the well gets up and pumping, Darlene still won't be out of a job. A new well doesn't mean homes will suddenly have new plumbing. What it means is clean water will be more readily accessible, a first step. The next will be building gravity-fed storage tanks like these that could be hooked up to faucets inside. But that's several years and probably countless fundraisers away.
Things are not simple here. But every time we have even the smallest success in this project, those little moments are so tremendously impactful for me. I think I'm really starting to live for this project. It's ours.
Do you think you'll ever see a day where everyone here has water?
I just hope so. I just pray and that they'll have running water. Yeah.
A simple wish the Navajo people hope won't just be a drop in an already empty bucket.
That's a very telling video clip, a very disturbing one. And it almost as if you're looking at a third world country, but that's right in America. And that's something that's constantly going on now, particularly with this Native American tribe, the Navajo Indian. Next slide. Well, the millennials, as I said earlier, are leaving the reservations to find better opportunities. And so many of those left behind are the older ones and sometimes the more sickly ones. And our guest at the end of this presentation is going to say that some of that is reversing. Some of them are coming back and giving back. Next slide. But why are they leaving? Well, they're leaving for better educations because the tribal schools lag behind. Next slide. And they're leaving because the rate of high school education is so low on the reservations, they have to go elsewhere. They go outside the reservations to get a better quality of education. Next slide. And obviously they're leaving because of economic stress, the poverty that exists, which is 47% of the Navajo Nation families live in poverty compared to 9% nationally. Next slide. And the extreme poverty as well. It's not just simply on a monthly basis, but it's very extensive poverty. And this one here in the Apache Reservation, 6 times the national average. Next slide. And to escape the despair, the hopelessness that you might have seen on some of the faces there. And this is very sad and very troubling. The highest rate of suicide among ethnic groups. It's the second leading cause of death among Indian youth between the ages of 15 to 24. Extremely troubling. Next slide. And when you look at the budget of the Indian Health Service and what it has to offer these tribes all over the country, $4 billion has been allocated, but they really need $15 billion. Next slide. This is a woman that I wanted you to know about. She has passed away, but Wilma Mankiller was one of the most ardent, fiercest activists, feminists, and advocates, and she was a Cherokee chief. She's a model for what needs to happen in the community now that politically they have more of a voice, and she was one that took the lead. And hit it again, please, Bill. And she was even honored by being on the front of the cover of Time magazine. Wilma Mankiller, quite a name, as a matter of fact, but clearly she was a force to be reckoned with. Next slide. The coronavirus pandemic has also been devastating to the community, and clearly that has hit the Native American tribe dramatically. Bill, I'm going to go on and not show the next video because I want to get to our conversation with Ayanna. So give me 2 slides now. The media, this is a way that you can get information to the Native American communities. Radio is something, not much TV, but radio, live radio, definitely can get the information out to this community in a very real way. Next slide. Indigenous Peoples Day, that's what now we are calling Columbus Day, because we want to honor all indigenous populations, including the Native American, Alaska Native, Hawaiian Native, and other tribes as well. Next slide. And November is National American Indian Heritage Month, as we have Black History Month, Hispanic Heritage Month, Asian Pacific Islander American Heritage Month, and we have Native American Heritage Month. Next slide. It is my pleasure now to introduce to you Ayanna Smith, who's a member of the Shinnecock tribe, and she's going to share with us information about her life, what she has done, and her organization called Blossom Counseling Services. So Ayanna, why don't you join us so we can share you with the audience?
Hi, good evening.
Hello, hello. Nice to see you, Ayanna. Thank you for joining us.
Thank you for having me.
Well, you saw some of the videos about the Navajo tribe and some of the other tribes. Tell us a little bit about the Shinnecock tribe, which is located on Long Island. Is that correct?
Yeah, we're located on the east end of Long Island, out near Southampton. I can say I can relate to a lot of the things that were shown in the video clips about the Navajo reservation. I can certainly remember growing up where people had dirt floors, no running water, and we are located in one of the wealthiest zip codes in the United States. You know, you take 2 steps away and you're in the area of the 1%ers. We probably have the most billionaires living right across the street from us. And at the same time, you've got people who had dirt floors and no running water and electricity. So I can relate a lot to that. What I can also say is that, you know, our reservation is definitely in a stage of development and building capacity to be able to provide a lot of the services that you were speaking about. Our nation received federal recognition status in 2010. And from that point, probably in about 2012, 2013, we started to engage in some of those government contracts and government grants. I've been working as a tribal administrator or executive director for the tribe on and off for the past 8 years. And I've really helped to increase the quality of life for a lot of our tribal members.
How large is the Shinnecock tribe? What the numbers?
Sure. So there's about 1,600 of us in total. There's about 600 of that live on the reservation, or sometimes we call it territory because it's a little bit different. We're not exactly a reservation as defined by the United States. We're actually a territory. Yes, and our land base is, we have probably about 800-acre peninsula that we live on, and then we have another 200 acres of waterfront property in the neighboring town. And we just use it for we don't develop it right now. It's mostly just used for cultural, spiritual gatherings and stuff like that.
I see. Talk a little bit about the family structure in the Native American family. We saw in the videos that many families, several generations living in the same house. Is it the same with your tribe? How is that set up?
Yeah, absolutely. It's very common. We have a lot of multi-generational families. We are definitely a matriarchal tribe. It's kind of interesting. When I grew up, women in my tribe didn't have the right to vote for vote. However, I think that was more of our delineation of responsibilities because the women did have the strongest voice and were able to inform our leadership as to what direction to go in. So women are definitely the decision makers, but the men are more or less the external representation of that decision.
Very interesting. Are there cultural traditions or rituals that your tribe engages in on an annual basis? Are there special occasions?
Yeah, absolutely. So we are a part of the Algonquin language speaking family, and so our traditions are very similar to a lot of the other Algonquin speaking tribes. Algonquin is the largest speaking group in the country. And so we have something coming up very soon. Actually, it's called June Meeting, and that is like a celebration of the springtime, rebirth. It's kind of like a homecoming for us, and an honoring of the first fruit, which is a strawberry. And we have a lot of gatherings, and that is interesting because that is a combination of both traditional indigenous practices and Christian practice. So
interesting.
It's one of the ceremonies that's been preserved through the church. So that's kind of interesting. And that happens. Yeah. And then in September, we have our annual powwow, and that's a event that the whole community participates in, and there's just so much to it. I mean, we have thousands and thousands of people, for indigenous and non-indigenous people from all around the globe, come, share stories, exchange traditions, meet new friends, culture, dancing. It's probably one of the largest powwows on the East Coast that we have, and that's always Labor Day weekend in September.
Okay.
And then our third main ceremony is something called Nanawa, which is around the time of Thanksgiving. It's not on Thanksgiving, but it's around kind of that same time period. And that is about honoring the ancestors. It's about, talking about those who have crossed over. It's about preparing for harvest. It has a lot to do with harvest time as well.
Wow, interesting. Well, tell us about Blossom Counseling Services. You told me that your name, Ayanna, it means blossom in Indian dialect. Yes?
Yeah.
And you're a social worker, correct, by training?
Yes, I am a social worker. I wear many hats in the community. One of the things that I recognize, like a lot of statistics that you shared, ring very true for me in my community. And so one of the things that I learned is that our tribe really didn't have the capacity to be able, and the infrastructure, because we're still developing, to provide the kind of quality care and services that our nation members really need. I used to work for outside agencies, and I was limited by what I could do. Even though I was servicing the nation, I was very limited by their policies, their procedures. They wanted me to do the things the way they wanted me to do them. And I had a whole team of people that I felt that we had the capacity to be able to provide a better quality service to our tribal members. So I separated off. I started a nonprofit, Blossom Sustainable Development, which is more about protecting, preserving the culture and health and well-being of our community. And then I also have, under that, I also have a private practice, which allows me to provide access to care, because I can bill insurances to provide mental health and case management services too. And I also did that because, like you were saying, there's a lot of tribes that don't receive services in our area because they're not federally recognized. We have a lot of tribes in our region that are still tribal people, but they don't have access to same services and benefits that other people, other federally recognized tribes have. So I wanted to make sure that I'm able to service as many people that I can.
Awesome. And you do a lot of work with youth, don't you, in the community?
I do. Yeah, we run a really cool program. I heard you talk a lot about nature, and most practice is nature-based. I use a lot of nature-informed ecotherapy work with the clients that I work with. It's all about helping them to build a relationship with nature and use nature as a therapist. And in particularly with the youth, particularly kids that might have like ADHD, trauma, really helping them to learn, practice mindfulness activities that are really outdoors and really using nature as a therapeutic tool. And also adventure and curiosity, and helping them to get to a state of calm alertness. So that's a lot of the work that I do with youth.
Awesome. That's fantastic. How does it make you feel when you see these clips about the Navajo tribe and all of the other things that are being discussed around the country as a Native American woman? How does that make you feel?
Well, there's definitely a sense of connectedness. I think that we all share a lot of the same common stories. Of course, we all have different influences. I think it's really important that historically each and every one of us has a different relationship with either the United States government or with the local government. So we've all developed very differently. And so the policies are very different. And the relationship between the tribes and the government are very different as compared to, it's not just one broad stroke. So I think that the differences in that relationship has a lot to do with the policies and how each tribe is impacted. So, like, for example, with my tribe, even though we only got federal recognition in 2010, our history is not with the United States. Our history is with England. So all of our deeds, all of our treaties, everything that is our foundation was with England. And so it was long before contact. So most of the tribes that you showed are all what you call post-contact tribes.
Right.
relationship with the United States. We precede the United States, right? So then when colonies came, then we had relationships with the colonies. Then New York State came, we had a relationship with the state, and then the United States. So we had need to be federally recognized because what? For what? Like, what was the point?
Right. Yeah.
We're talking 100 years of dealing with Europeans. There's no point at that 200 years down the road to even have a relationship with the United States. So I think that we developed a lot differently. So even though we're late in the game with federal recognition, we do have a health clinic, we have education programs, we have senior programs, and all of these we got before recognition.
Fascinating. Well, I'm going to stop there, Ayanna, but stay where you are. And Jennifer, you want to come back on? Because we may have some questions that people would like to ask you or me, and just wanted to have a few minutes of that. So thank you for that.
Thank you both. This has been incredible and really enlightening and, troubling to see a lot of the video. But, I think, one of the questions that we have, and we have this, Ayanna, in every program that we've done, is that people write in the question, what can we do to help?
Yes.
So I would definitely say being more aware. Like Sheila was doing amazing work with raising awareness about Native American people. I think that is one way, is just to raise awareness, get more knowledge and understanding. Also, I think that really developing a sense of connectedness to the land, because all Native cultures, regardless of where they come from, they have a special relationship to the land and the resources. And they're really set up to protect and preserve and develop those resources. And I think we have a different worldview that clashes with the sense of capitalism and individualistic way of living, as opposed to a more communal way of living. So I think being knowledgeable of that difference. So when people are going into Native communities, maybe donating to Native organizations, providing whatever skill sets that they have to Native tribes, I think it's really important to understand that that we're a collective and a whole and interrelated and family based, and that we see the world and particularly the natural world and all of its resources, because a lot of these fights are about resources and access to resources. We see those resources as an extension of ourselves and not something separate from ourselves. And that's a real understanding that would help to build bridges and heal some of the wounds, is seeing this world as something that we're all a part of, a living, breathing entity, not something to be put in a box or soul, but something that we're a living, breathing, holistic approach. And I think that's really important when working with tribal communities.
Thank you. Thank you for that answer. That's very insightful. I do have one other question for you. Someone is hold on a second. I'm trying to see it here. Someone is asking if tribal members observe U.S. holidays and are Native language still taught on the reservation?
Yeah, so there is really a very big push across Indian country to preserve language. Like, for example, my tribe, we were pretty much colonized and Americanized, Europeanized before there was America. So by the late 1700s, before they even discovered the West, we were already speaking English, practicing Christianity. But one thing is that the Bible, one of the first publications in the United States actually was the translation of the Bible into our language. Wow. So through having that Bible, we've been able to revitalize our language and teach that to our program. So yes, absolutely, language is taught. And in terms of holidays, that's a touchy subject. You know, I think that for the most part, you know, they celebrate like the commercialized version of the holidays, right? Like if it's like everybody, like we've got 4th of July coming up. So like everybody's gonna like throw off fireworks and have parties, but they don't think of it in relationship to the history of what Independence Day is. I mean, some people are very Christian, so they might celebrate Christmas, but I would say maybe Veterans Day and Memorial Day, because there's a huge population of tribal people that are veterans, so those might be more celebrated with authenticity of the reasoning of the holiday. But a lot of holidays, like our holidays are our traditional holidays, like that's what we really celebrate and really feel, you know. But a lot of, and I can only speak for my tribe. I can't speak for tribes across Indian country.
Well, thank you. Thank you for sharing these answers and your authenticity, and for all of the work that you do. I'm a fellow social worker as well, and the work that you do and the impact that you're making is beyond, it's really incredible work. So thank you for both for sharing this with all of us today.
Yes, it's hard to see some of this. Ayanna and I were talking about it in preparation for this, and we both said knowledge, education, and awareness, you know, hopefully that humility, that cultural humility and empathy. It breaks my heart when I see that clip about the Navajo Nation and the woman who never had running water in her life in this country. So clearly we need to talk to our legislators that have jurisdiction over those areas and see what can be done and see what services can be provided. Surely there are a lot of people that are working towards that. And Ayanna, you're one of them. And we applaud you and we celebrate you. And now that we know, I'm going to come out there for that powwow that you said in September. I want to experience that. So clearly that's a part of really understanding these communities. So thank you so much from the bottom of our hearts for all that you do in the community and all those who surround you. And we wish you the best, and hopefully we'll stay in touch. And again, thank you, MS Views and News, for this conclusion to this multicultural series that I hope has brought us all closer together, as Ayanna said, to really know that it's going to make each one of us to make a difference for all of us. Thank you.
Thank you.
All right, good night. Be well and stay safe. Bye-bye.
Thank you. Thank you.